Hi, I'm Dr. Tracey Marks, a psychiatrist, and I make mental health education videos. Today, I'm answering a viewer question about how to get a friend or family member to get help for their mental problem. Here's Hector's question. Hi, Dr. Marks. My wife was diagnosed with bipolar 1 disorder, but she is not getting treatment for it. This is really taking a toll on our marriage. How can I approach her to get the help she needs? Thank you, Hector, for your question. I have to preface this by saying there's not a one answer fits all for this question. The specifics of what you actually say or do depend on circumstances, like how much impairment does the illness cause? How much insight do they have into their illness? How accepting are they of their illness? You can have someone who doesn't accept that they have an illness at all, despite being very functionally impaired. Or you could have a person that accepts that they have an illness, but doesn't take their medication consistently because they don't think that they always need it. So this person doesn't appreciate the need for consistent treatment, but at least they've gotten as far as accepting that they need some kind of treatment. These are just a few of the factors that guide you on how to handle this. And even then, what works for one person may not work for another. So that's the disclaimer here, and that's the reason there isn't much information online about exactly what to do, because there isn't this one thing that everyone can do. But here's some general principles that can guide you for your particular situation. So let's go back to Hector's question. His wife has bipolar disorder and she's not getting treatment. I'll assume that means that she hasn't seen a doctor, or she's gone in the past, but she's currently on no medication for it. Bipolar disorder is an illness that can cause a person to become psychotic, either when they're manic or when they're depressed. But usually those are temporary states. That matters because when the person is not psychotic, you can have a rational conversation about their illness. This is in contrast to a psychotic illness like schizophrenia or even delusional disorder, where the main problem is that the person has trouble differentiating between what's real and what's not real. With those conditions, you're not going to be able to argue the person out of their psychosis or convince them using logic that they need help. So here are some suggestions for the person who is not experiencing a break from reality. Giving the person an ultimatum does not work well, like, if you don't get help, I'm leaving you. The person may grudgingly go to see a doctor or therapist, but if their heart isn't in it, it's not going to go far. So a different approach would be to meet the person where they are with whatever pain points they have. So Hector's wife has bipolar disorder, and she should be having some degree of suffering. Maybe she's having trouble sleeping. Maybe she's at risk of losing her job. If she has children, maybe she can't keep up with them and feels like a bad mom. Once you identify these things that bother her, focus on getting help because of the impact that these problems have on both her and the family. You're not trying to guilt her into getting help. You're just trying to help her see beyond herself, that you're interested in helping her reduce all of these negative impacts. For example, a depressed mother who can't get out of bed may be motivated to get help so that her children won't suffer or won't see her in that state. Similarly, with your marital relationship, instead of focusing on what she's doing to turn you away, you could focus on how her suffering hurts you and how you really hate to see her not doing well. You're trying to show compassion for her pain because you love her and you want her to feel better, sleep better, and be able to work and so forth. Suppose her hypomania is manifesting as anger and she's snapping at everyone. Usually when people are like this, they feel bad about the fact that they can't control themselves and everything makes them angry. This isn't the kind of entitlement rage that comes from a personality disorder. This is having very little frustration tolerance and being unable to control your emotions due to a mood disorder. So the person usually has some regret about the fact that they can't stand you. So in this case, instead of fighting back with her because you're sick of her stuff, a different approach is to show compassion for that irritability. So let's role play and say, I'm you. Instead of saying, you wouldn't be yelling at me if you take your medication like you're supposed to. Instead, I could say, I hate that all these things that I do irritate you. It pains me to see you upset like this all the time. I really wish you would consider getting help or to take your medication so you won't feel as bad. Now, what I've just said applies more to the situation of someone who recognizes that they have an illness but doesn't want to get treatment. If your loved one has gotten treatment but is now inconsistent with it, before hounding them about why they're not taking their medication or seeing the therapist, you need to do a little work to understand why they're not adhering to the treatment. It could be because the medication has a bunch of side effects. If the last medicine that your wife took made her gain 50 pounds, she may not want to take that medication again. In this case, you'll need help from your doctor or therapist or some other source educating you and your wife on other treatment options. Also, in this case, instead of focusing on the pain points as a reason to get treatment, you focus on the benefits that she experienced by being treated in the past. You want to help her get her eyes on the prize. So when her symptoms start to return, help her remember how much better she felt when she was sleeping, getting her work done, when her mind wasn't racing. Another thing that can drive non-compliance with treatment is people forgetting what it was like when they were doing so poorly. I did a video talking about this phenomenon called bipolar disorder and the imposter syndrome. It was about people who felt like they were faking their illness because when they were well, they just couldn't relate to how they were feeling when they weren't doing well. So they conclude, I must have been faking it. That mindset actually is a huge driver of people not continuing to take medication because they just don't believe that they were sick or don't remember what it was like. So in this case, you don't want to throw in her face how bad she was. Instead, when things start to slip, you want to remind her of how this has happened before and she did get better. You want to focus on the positive endpoints, and the path to those endpoints is treatment. What if your loved one is psychotic and doesn't recognize that they have an illness? This is the most difficult situation to deal with because you can't have a rational conversation with them about their concerns. Usually people who hear voices will recognize that something's not right, but the person who's delusional believes that their delusions are true. I still think you could try focusing on the pain points, and this is what I do if someone is forced to see me by their family but doesn't believe that they have an illness. Often people who are delusional or bothered by the delusions may feel anxious, and they may not be sleeping, or they may be very fearful. So the focus of treatment becomes about helping them with their anxiety or fear response. It's not about debating about the delusion. It's about helping them with how their beliefs affect them. But that is just a starting place to get them through the door to see a doctor. If that person can somehow be convinced to take antipsychotic medication, they could get to the point where they recognize and appreciate that something happens to them that makes them think things that they don't think when they're not on medication. So even if they don't believe that they have a psychiatric illness, they still may like the fact that the medicine helps them not be anxious about all these things that they believed. The second part of this story is compliance with medication. If the person doesn't believe they have an illness, they may eventually stop taking the medication and become delusional again. Even though ultimatums are not a good way to motivate someone to get treatment, sometimes you have to use contingencies to get someone to stay on medication. Setting up these contingencies works best when the person is well enough to understand them. So for example, if you have a family member who can't work because of their illness and you're supporting them financially, to continue to get your support, they have to stay on their medication. That's the most common example, but there are other if-then scenarios that you could create depending on the dynamics of your situation. And this usually boils down to how much support you're giving the person. But it can also be related to contact. If this is a family member that you see on a semi-regular basis and this person stops taking their medication and becomes verbally abusive, you could let them know that contact with you is contingent on them either being in treatment or containing the behaviors. And if the person wants to be around you enough, they can do whatever they need to do to be able to contain whatever behaviors are objectionable. Now you may say, how can a delusional person know how to contain their delusions? They don't contain their delusions. They contain the behavior that they engage in because of their delusions, even if they don't agree that they have a delusion. So for example, let's say you have an aunt with a psychotic illness, and you can always tell when she's not taking her medicine because she accuses you of poisoning your children. You could say something to her like, "Auntie, it hurts me when you say this." She may jump in and say, "Well, then you need to stop. Up. Hear me out. This is really important, and I'm only going to say this one time." You also want to bring up the hurt because you want to couch what you're saying in a way that makes her feel less defensive, and you're by focusing on how her behavior affects you. That makes it less threatening because now you're identifying yourself as the weak link here because you're hurt. So let me continue. It hurts me when you talk this way, and I know that you don't say these things when you take your medication. I'm not going to come around you if you continue to speak to me like this. It really is not my business whether or not you take your medication, but I'd like you to so that I can continue to see you. With this kind of statement, you're trying to make it clear that she's the one in control of the outcome. You're not trying to be judgmental about her being on medication or not, but taking medication gets this result and not taking medicine gets this result. And she knows what she needs to do and the decision that she needs to make depending on the kind of result that she wants. This kind of confrontation can easily deteriorate into an ugly back and forth. "You don't know me. Who are you to tell me this and that and the other?" When this happens, you take the broken record approach and have a canned statement that you can say over and over. In this case, it could be something like, "Okay, Auntie, these are my conditions. I'm sorry I won't get a chance to see you. You think you're going to keep me from seeing my grandniece? These are my conditions. I'm sorry I won't get a chance to see you." Now, in the heat of the moment, it can be hard to be calm like this. The way to make it easier is to practice. Anticipate how things can play out and have your condition statement ready and your broken record response ready. And then everything else after that, you just walk away. So as you can see, there's not one answer on how to handle dealing with a family member who won't get treatment, but here are the takeaways. For the person who won't get treatment or return to it, focus on the pain points and encourage them to get help for the pain points. For the person who's already been in treatment but is not following through, focus on the positive endpoints of treatment. These would be the things that would improve with treatment. You also want to understand what things are like for them and what their objections are. At first, you want to listen compassionately and not challenge them on their objections. People need to feel heard when they're suffering, and especially when the solution to their suffering causes them more suffering. So then it's about offering support and engaging in a partnership with them to see how together you can find a workaround. That is, how can you find treatment that's tolerable and gets them to those positive endpoints? For the person who doesn't appreciate that they even have an illness, you may need to use contingencies to get them to follow through with treatment. Thanks for watching. See you next time.